Welcome back to our channel, MedEquina. Today, we're going to delve into a very important topic that affects millions of people worldwide: asthma versus chronic obstructive pulmonary disease, or COPD. Both conditions can affect the lungs and make breathing difficult, but they are different in many ways. So, let's explore these two respiratory conditions and understand their unique characteristics. Let's start by discussing asthma. Asthma is a chronic respiratory condition that affects the airways, the tubes responsible for carrying air in and out of the lungs. During an asthma attack, these airways become inflamed and narrow, making it difficult for the person to breathe. Common triggers for asthma attacks include allergens like pollen, pet dander, or dust mites, as well as respiratory infections, cold air, and even emotional stress. One of the hallmark symptoms of asthma is wheezing, which is a high-pitched whistling sound heard during breathing. Other symptoms include coughing, shortness of breath, and chest tightness. Now, let's turn our attention to COPD. Chronic obstructive pulmonary disease is an umbrella term for a group of progressive lung diseases, primarily emphysema and chronic bronchitis. Unlike asthma, which often starts in childhood and tends to be triggered by allergens, COPD is usually caused by long-term exposure to harmful substances, such as cigarette smoke, air pollution, or occupational dust and chemicals. COPD is characterized by the obstruction of airflow and difficulty exhaling due to the damage and inflammation of the lung tissues over time. The symptoms of COPD may develop slowly and worsen over the years. Chronic cough, excessive mucus production, shortness of breath, especially during physical activity, and frequent respiratory infections are common signs of COPD. Now that we have an overview of both conditions, let's highlight the key differences between asthma and COPD. Onset and triggers. Asthma often begins in childhood or adolescence and is commonly triggered by allergens and respiratory infections. COPD is more likely to develop in adults, particularly in individuals with a history of smoking or significant exposure to harmful substances. Reversibility. Asthma symptoms are usually reversible with appropriate treatment, such as inhalers or bronchodilators. COPD, on the other hand, is largely irreversible, and the damage to the lungs is permanent. Progression. Asthma symptoms may come and go, and many individuals experience long periods without any symptoms. COPD symptoms tend to worsen gradually over time, leading to a progressive decline in lung function. Managing both asthma and COPD requires a comprehensive approach. Treatment plans may include medications, lifestyle changes, and regular follow-ups with healthcare professionals. For asthma, quick relief medications like bronchodilators provide immediate relief during attacks, while controller medications help prevent symptoms over the long term. COPD treatment may involve bronchodilators, inhaled corticosteroids, and pulmonary rehabilitation programs to improve lung function and overall quality of life. While both asthma and COPD affect the respiratory system and cause breathing difficulties, they have different triggers, age of onset, and treatment approaches. Understanding these differences is essential for proper diagnosis and management. If you or someone you know experiences persistent respiratory symptoms, consult a healthcare professional for a proper evaluation and personalized treatment plan. That's it for today's video. If you found this information helpful, don't forget to hit the like button and share it with others. Also, comment down below on any other health topics you'd like us to cover in the future. Thank you for watching, and we'll see you in the next video. Stay healthy and take care.